Okay, this is going to be central line dressing change. I just wanted to show my box and the wristbands before I started, and I'm going to scan my room. Okay. Going to begin by showing up dressed in uniform policy. Going to check the order form and hospital policy and identify the patient using two identifying factors. So I'm going to use Jaguar Jones 8/25/1963, and he is allergic to penicillin. I will also ask Mr. Jones if there's anything he's allergic to that's not listed, and I will explain the procedure to him and introduce myself. At this time, I would allow the patient some privacy. I will move my trash can closer to me and then perform hand hygiene. At this time, I'm going to open my kit aseptically or away from me and remove my box from within. I'm going to open just the first side and remove my patient's mask. And I'm going to just simulate it going on him by placing it on the box. And then at this time, I'm also going to put on my goggles and mask. Next, I'm going to don clean gloves. Now, while the film is still over the insertion site, I can palpate the site and take note of the appearance. But after I remove the Tegaderm, I'm not going to touch the site. So I'm going to remove the Tegaderm going towards the insertion site. And I'm also going to remove the bio patch, again avoiding touching the site. Again, now I'm going to take notice of the appearance around the insertion and look for any signs of infection or edema. If it was indicated that I needed to take a cultural swab, this is the point in which I would do it. Those indications would typically be any type of drainage or edema. And now I'm going to remove my clean gloves with the dressing intact, or the dressing inside. Okay, next I'm going to open my packaging, avoiding touching my sterile field. And I'm going to remove my sterile gloves from inside. Next, I'm going to don my sterile gloves. Now that I have my sterile gloves on, I'm going to organize my materials. And the materials within need to be there is a 1-inch border. So just being careful not to go outside of that 1-inch border. Next, I'm going to cleanse the site. First, I'm going to use my alcohol swab. And I'm going to hold the catheter with my left hand, so now my left hand is contaminated. And I'm going to go in circular motions around the insertion site, starting all the way close to the insertion site and moving outwards. Never going back over what I've already done. Once I've completed this, dispose of my alcohol swab. And now I'm going to use my chlorhexidine and just crush the wings in to release that chlorhexidine. With the chlorhexidine, I'm going to clean all around the insertion and on the catheter, and I'm going to use horizontal, vertical, and circular scrubbing motions, and I'm going to scrub vigorously for at least 30 seconds. Again, cleaning both the insertion site and the catheter. I'm going to dispose of that. Next, I'm going to attach my BioPatch, and there is a slit in it. And it's important that the blue side goes up, and I'm not going to let my right hand touch the insertion or the skin. Okay, and now I'm going to lay the catheter down. Now I'm going to take the Tegaderm patch. I'm going to peel off that side. And my left hand is contaminated, but I'm not touching the sterile part of the Tegaderm with my contaminated hand. And when placing my Tegaderm on, I'm going to cover up to the catheter. I want the insertion site to be in the middle of my Tegaderm. And now I'm just going to walk around the Tegaderm, securing it as I peel up the side, making sure that it's smooth. Now I'm going to set my Tegaderm wrapping to the side because it does have my label on it. And at this point, I'm going to remove my sterile gloves using glove to glove and skin to skin method. And dropping it to the trash can. Now I'm going to label my Tegaderm to go on my dressing. And this will have the date, the time, and my initials. And it can just go on the edge. Now I'm going to remove my patient's mask and my mask. From here, I would clean up all of my supplies. Place the patient in a comfortable position. I would move a pillow if my patient was on a pillow so none of the secretions or anything get on his or her pillow. But if they do not have that pillow, I would give it back to them. Again, lower their bed, raise their side rail, make sure they are comfortable. And now I would move on to documentation. In documentation for the central line dressing change, I'm going to put the appearance of the area or the surface of the skin. If there's any drainage, if there is drainage, I'm going to put the amount and the secretions. I would also put, if I obtained a cultural swab, I would put the patient tolerance, the type of dressing, type of cleansers, and my date, time, and signature. And that completes central line dressing change.